Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. We are having sort of a hit and miss kind of with webinars right now because I'm doing more traveling. I am leaving for American Association of Equine Practitioners on Wednesday, and so I won't be back home until December. So we'll probably try and pick up more webinars in December. I've got some people I need to go and get scheduled, and I have some really interesting topics. But in the meantime, I am so excited to have Marie Hancock back because she's just a great presenter, and we're going to talk about like the weather changes and the risks in weather change, right? Did I get that right?
That's right. Yeah. Well, and I will say, like, I didn't have as much time to work on PowerPoint, so it's shorter. There are less pictures, but I thought we could discuss things, make it more of a discussion this time. And, I'll try to do as much as I can. My daughter's in a play this week. So
that's okay. I mean, just the discussion we just had about, the tropical storm and the change in barometric pressure and colics, because, people anecdotally, I think people have like, oh man, the weather's weird and hopefully we won't have a colic, but it sounds like it's more than just anecdotally, like there really is something to it.
Yeah, I definitely think that's it's repeatable enough that I think there's definitely something to it.
Right.
Well, but I do have a few slides, and what I thought I'd do is kind of go through some stuff, and if you can help me make sure I'm looking at the chats, so if
I'll keep track of the chat and the Q&A for you. No problem.
If anybody has any questions, we can
definitely screen, so I got it up there and you don't even notice it.
Perfect. Yeah, just let me know and we'll try to, attack anything that you guys want to chat about. Okay, so I'm going to share my screen.
Did I make you co-host? Nope, you make it co-host, then you can share your screen. Okay. Yep, you're good.
Okay, and then we'll start this. You guys can hear me and see me?
Yep.
Okay.
I like your background.
Thanks. I thought it was pretty.
Yeah.
Come on. Slideshow. From the beginning. Here we go. Okay, so we're just going to talk about some, fall, winter horse care woes that you might see, and we'll chat a little bit about, why that is, and maybe some preventatives you can do to prevent, any health problems associated with them. So let's get started. So I picked the 5 that I can think of that are things that we see in our area. And I'm sure that those of you that live in different areas of the country, you probably each have things that happen in your area that may not happen in our area. So if you have something that you're thinking of that you want to talk about that's not on the list, just, bring it up and we'll see what we can come up with. But, for us in Northern Virginia, we have lots of rolling hills and grass, and we have very typical seasons. So, we have a very classical fall with all the falling leaves and the beginning of the frosts, and, some dry spells and wet spells, and lots of molds and lots of pollens when the leaves fall. And then we have like a 2 to 3 month winter that goes down to the 10s and the 20s, and we get a lot of ice versus dry snow. So what we see with winter is going to be more of that sort of wet, icy winter. Whereas if you guys are out west, especially like Montana or Colorado, I think it's very different because the snow is powder. So you don't get some of the things that we get out here. And that usually ends in about March, and we get this huge thaw, and the mud is 2 feet deep sometimes because all the snow melts. And so the horses have a lot of problems with that, with tendon and ligament injuries, and we get like all kinds of abscesses that all of a sudden come out because they haven't come out all winter. So there are lots of patterns associated with the seasons here that I think are very different depending on where you live. I would bet if you live in the Northwest, because it's so wet all the time, you have a different sort of seasonality to it than we do out here. And so the first thing, these are kind of the ones we're going to go through, but the first one I thought we'd talk about is what we call winter laminitis. So there are 2 other types of laminitic events that are really sort of very typical that people talk about. So the first one is like your insulin problems, sugar related spring laminitis. And then you have the fall Cushing's laminitis, which is usually like early fall, late summer. And then we've been seeing these, what we're starting to coin as a winter laminitis. So it's a time of year where they should not be foundering, and they are. So we're going to talk about why that is, because it's not something that I think we have figured out, because it doesn't fit one of our other ideas on laminitis. And then just like we kind of mentioned, we'll go back over, you do see a lot of colics in the fall and winter. And why do you see those? It has a lot to do with diet changes and husbandry changes and weather changes. And so we'll go through that. And then another one that we see in our area that is probably more specific to Virginia, Kentucky, maybe Pennsylvania. I don't know. Do you know if they see a lot of botulism issues in the Northeast, Wendy? Do people worry about that?
I know Pennsylvania, because it was New Bolton that was working on something for that, but I can't remember if I've seen it up north.
Right. Yeah. I feel like it's kind of this mid-Atlantic plus Kentucky, is where I see it the most, or hear it talked about the most. So we're going to talk about botulism for those of you that are in those areas. And then of course, respiratory disease, whether that's infectious or non-infectious. It can be environmental or allergic, right? If it's non-infectious. So we'll talk about all of those. And then problems associated with the winter sort of weather problems, like ice or frozen terrain or slippery areas, or hard versus soft or muddy, and what that might mean for you guys. So those are kind of the problems I have. Does anyone have something else that they want to talk about? If you do, please put it in the Q&A and we'll make sure that we mention it. Okay, guys? All right. So winter laminitis. So this is kind of an odd one, right? Because normally when we talk about laminitis, we're talking about something that has occurred and we know, at least we think we know what is causing it. So the most common sort of laminitis that we see out east, because we have such beautiful green lush pastures, is spring laminitis. So they're doing fine all winter. They're not getting a whole lot of sugars. They're on, a hay that's a low, starch. They're on a very controlled diet. And then all of a sudden the grass comes up, and that grass has been sitting under, dormant right under the ground for the last 3 or 4 months, just, absorbing sugars. And so it's like going from, celery to a candy bar, as far as the amount of sugars that they're getting when they're eating the hay. It doesn't have a lot of sugars in it. And then that first little grass that comes up that they're all so excited to get right at the roots and nibble off is super sweet. And so we think that extra sugar then causes like a bacterial change and maybe an endotoxin level that increases in the gut. And, we think that along with high insulin levels, which causes inflammation, then kind of circuits them into this, founder laminitis episode in the spring. So that's what causes that one. So then we talk about our fall laminitis, and we think that that's related to endocrine or hormonal changes with the pituitary gland. So our theory is that the pituitary gland ages and gets soft, and it doesn't work as well as it should. And so we have problems with regulating cortisol, which is a steroid level in the body. And when that level gets too high, it can suppress the immune system. It can change the way the lamina are put together. So instead of digitating and being a nice, woven connection between interior and exterior lamina, they start to stretch and pull. And so you'll see those horses that have a stretched white lines, the white line's longer than it should be, and the toe will be kind of long, and there'll be a gap if you take an x-ray between the outer wall of the foot and where the coffin bone is. It's like a little gas pocket because they're stretching apart. And so those ones kind of they're insidious because they're like a slow, like almost like a slow boil, right? So they're getting worse, but they're kind of holding it together. And then it's like all of a sudden the steroid levels rise, because they do in the fall. And it just kind of sets them up, and they end up with a laminitis episode. So we kind of know what causes that. The ones that we're seeing that are more winter related, we're not so sure about. Usually if you check them, their insulin levels aren't that bad. They're not super overweight. Their diet's pretty controlled. They're cortisol levels in their pituitary, testing is all starting to get better because it's winter and it always looks better in the winter. So, you're kind of looking at it going, what's going on? Why are they having these laminitis effects? And so, I think maybe if they have uncontrolled Cushing's for some reason, maybe that could be part of it. But my kind of working theory is that we have a lot of low-grade inflammation that we're not controlling. And maybe the diet isn't appropriate for them in some way. So, as I have gotten more into the holistic side of things, I'm a lot pickier about what I'll feed my horses. So for those of you that are feeding, a general processed feed, there can be a lot of inflammatory things in that feed. So when you look at a food label, a lot of times people will tell you, look at the crude protein and look at the starch and look at the percent fat. But I think what we should all be doing, especially with horses that might be inflamed or maybe more at risk, is looking at what ingredients are in that feed. So like we know that soy can be very inflammatory. We know that wheat middlings can be inflammatory. If you're getting a lot of anything that's a byproduct meal, or anything like even brewer's yeast sometimes is, just a handoff that they're feeding. We get a lot of extra fillers in feeds that are what's left over after another source of food is processed, and then they throw it in and they use it to calculate those numbers, but they may not be as digestible or they may be more inflammatory than we know. So I wonder sometimes if that's part of it, is that we're maybe feeding feeds that are more inflammatory because we're going in the winter and they're not getting the grasses that they were before. So we're having to increase their feed to get them through the cold. And maybe that's part of it, is we're increasing the inflammation in their diet. It could also be that they're more stressed, like in the winter, they're probably not out as long, so maybe just being in all the time and they don't like being in as often, or they're not getting to move around as much, or, they're more stressed because they don't like their neighbors when they're in and they want to be out, all those little stresses can, add up. So little things like that can make a difference. The other thing that we're starting to think about, and especially here, like we were talking about, in the fall, when you have all of these leaves that are coming down and you have all of the molds because we have dampness and then cold, I think we end up with a lot more fungus and mold on our grasses and in our fields than we do the rest of the year. So I think all of that can add to the inflammation in the body and certainly add to the inflammation in the gut. So if we have a lot of inflammation in the gut, we have a lot of stuff that we're dealing with, we're probably more likely than to have inflammatory mediators that are circulating in the bloodstream, and that can then cause laminitis. So we know that there's something called metalloproteinases that go down and can cause inflammation at the level of the capillary beds. And that's what happens with laminitis sometimes, is it affects the blood flow. So if we have all of those things, and they're creating inflammation in the body, then maybe that's what's causing the laminitis. So, these are all like my little speculations on what causes it, because we don't know for sure. So don't take this as God's word. It's just my little speculation. And then I think the other thing that we need to think about is that when we have a lot of cold, the body then shunts blood from different areas, like from the periphery, and puts it into the core to keep that warm, right? So if they are already sort of lacking in blood flow to the area, then I wonder if just that little bit of change in blood flow is enough to create a problem, for that lamella connection, right? Because we need to have a healthy blood flow to the inner and the outer lamina. So that means that we have to have blood flow on the inside around the coffin bone, and also at the top of the coronary band, right? So we can get all of the blood flow to the foot, it should be good. So if one or both of those kind of shuts down because of the cold, then maybe that's part of what causes it. So, for me, we need to be really careful about what we're doing, right? So, do your diet changes slowly. If you're going from grass to hay, I would introduce your hay. now or before now, even, you know, like start putting hay out in September, October, even though they're not eating a lot of it. So they start to kind of adapt to it and get used to it. So it's not a big change. And I think sometimes that helps anyway, because then all of a sudden you'll notice like 1 week you're going through hay and you weren't before that. So it's a good way for you to kind of know, okay, there's no good grass in my pasture anymore, because they'll tell you really clearly.
Yeah.
So doing that kind of stuff is good for your management of your horses, but also maybe to transition them from grass to hay. I think also removing muzzles is a hard thing, because most horses come out of muzzles and they're starving. You know, it would be like, you know, I'm sure that many of you guys have been on a diet, and you know how if you don't take that little, you know, break where you give yourself a day to just cheat and eat whatever you want, that, you know, at the end of the month, you just have to eat as many bad things as you can for yourself, because you haven't, and you've been staring at it hoping you could have it. And I think that happens a lot of times with these horses that are muzzled, that when they first come out of the muzzle, they'll eat anything because they're voracious. And so that can be a hard time for them, because they might be, you know, eating weeds because all of a sudden they don't have a muzzle, and they'll eat whatever's out in the pasture, and they're eating maybe more than they would have whatever weeds or fungus or mold or whatever we're talking about is out there, because they haven't had a chance to. So I think we need to be careful of that. I'm not a huge proponent of muzzles for that reason. I think that most horses, given the chance to eat hay all the time, will kind of slow their roll and not eat as much, you know. So anytime we can try to get them out of the muzzles, I try to. There are some horses that absolutely need them, but, you know, I think that that's part of it, is transitioning in and out can be really hard on their gut. And then the same thing if you're adding concentrates, you know, maybe trying to do something that's like half forage based, like a hay pellet and then a concentrate, you know, or something that has a low NSC. One of my favorite things to feed is cool stamps. Have you ever heard of that, Wendy? Do you use cool stamps?
I have. Is that the coconut based one?
Yeah.
Yeah, my horse went.
Right. And they either like it or they don't, right?
Yeah.
So, you know, my horses love it. And what I like about it is it's low NSC, it's high protein, it has a little tiny bit of fat, but not much. And it's like, the best thing about it is that you can feed it, and you put it out, you know, you get your bucket ready, and then you add like equal parts water to your feed, and you wait 30 seconds and it's all absorbed and you can feed it. You know, so you don't have to wait like for beet pulp where you have to wait for 12 hours to feed it, or it's not like feeding, you know, alfalfa cubes where you have to soak them overnight, you know, so that they have absorbed enough water. You don't have to worry about choking or anything like that. You know, so I really like it for that reason. But for the horses that think it's disgusting, like Wendy's, there is another product out there that's called Renew Gold, and it's made by Cargill. And I would stick with the original. Don't use the senior, just because the senior ration has some byproducts in it that I don't really like. But the original is pretty clean, and it has the coconut meal, and then it also has rice bran and flax meal in it. So, you know, for those horses that need extra calories for the winter, it's a really safe feed. It doesn't have a lot of starch, but will have the energy that they need. So that's kind of one of my favorites to add in with the skinny old horses, is the Renew Gold. So if we have time, Wendy, can you remind me that choke is another thing that might happen in the winter more than the rest of the year? Yeah. So I don't know if anyone else wants to chat about that, but I'm just thinking about it.
Somebody was asking about feeding cooked oats and soaked alfalfa pellets. Like you've touched on alfalfa pellets.
Yeah, I definitely like the soaked alfalfa pellets. So I have fed alfalfa pellets forever. So it's one of my favorite things to feed. I did read a couple articles last year, and I'm not sure exactly what to do with it. But they were talking about how, so this is kind of like my interpretation of what was given to me in the article. So the article was about how great this feed was, because it had all kinds of alfalfa in it, and it was creating all of these volatile fatty acids. And oh, by the way, that does cause hindgut acidosis, but we're totally cool with that. Like that's how it was presented in the article. But to me, and that kind of sent my brain in the other direction. And I started wondering about, do we have to worry about hindgut acidosis with alfalfa? And so we did do some research and started looking at doing a literature search and looking what was around. And I think that in some ways, alfalfa can cause some maybe like hindgut, not stomach, but more like large colon acidosis. So it's just something to think about if you have a horse that's maybe bordering on having a little of those sorts of colon upset, maybe loose stool or something like that, that it may not be as good as we think it is for that reason. Soaked oats are fine. I think they can be a little inflammatory, and I don't think they're as good as we used to think they were. I think that when all we had was corn oats and barley, they were great, right? But we have a lot of other things that we can use now. So I'm not as thrilled with them as I used to be. One of the ones that we've been feeding a lot of, which is different, is there's a company called Seasons Feed in Minnesota that makes Sainfoin pellets. Have you heard of that one, Wendy? It's spelled SAINFOIN, and it's a forage that seems to have a lot of good omega-3s, omega-6s. It doesn't seem to cause hindgut acidosis, and it has a lower starch and a really nice sort of altogether, protein, fat, sugar. It just seems to be really nice and balanced, and the horses like it. So we've started recommending that one. Huh?
Is it a grain?
It's a pellet. So it looks like a hay pellet because it is a hay. So you buy the hay pellet. So instead of alfalfa pellets, that might be another one to consider for some of these horses. But we've really, I think it's really good. So far, what I've seen with it, I'm pretty impressed. So it's just another one. If you have a horse that you're worried about, it might be something to consider. So I'm trying to think, we kind of touched on all this. So the different metabolic causes, the circulation, nutrition causes. I think when we really talk about nutrition, we're talking about, is it inflammatory? Is it high sugar when it doesn't need to be? Is it digestible? Is it a byproduct that you shouldn't be feeding? The other thing that I think is definitely something we should probably start considering, but it's going to be a little out there for being veterinary sort of mainstream, is heavy metals. And what does that do? So if you start looking at horses that have a lot of heavy metals, and you do like hair analysis, what you'll find is either they're excreting a lot of them or they're not excreting them at all. And for the horses that are excreting a lot of them, that's actually healthier. But it does mean that you want to try to clean up their diet. What we're finding that might kind of feed into this laminitis thing is that the ones that aren't excreting them at all are storing them. So that means they're storing them in their liver and they're storing them in their fat. And they're actually putting down fat to find a way to get rid of all of those heavy metals. So that would be another thing that could be triggering sort of this winter laminitis thing, is if we're somehow adding to that heavy metal burden with diet, then we maybe need to consider changing up what we're doing. There's a product, I feel like people get like, if they're listening and you buy things because I said so, tell them about me. So there's another really great product out there. It's called Organic Gut Solutions. I think they're out of Florida. And what it is it's an organic activated biochar charcoal product that you can feed that will help bind fungus, molds, toxins, all these sorts of things, and kind of help the gut get well. And that might be another thing to consider. If you think you have a horse that might be inflamed, you could do a month of that. And I don't think it's that expensive. I think it's like 30 or 40 bucks for a month.
Okay, so somebody's asking what the name of the Renew Gold product is that you like and the one you don't like.
So I just like the original Renew Gold product. There is one that's called, I think, Renew Gold Senior, and there, it says it has all kinds of extra stuff in it. Don't go for the extra. Just get the plain old one. Don't fall for, oh, I need the senior because my horse is a senior. Just get the original.
Okay. And then the charcoal.
It's if you Google it, it's OGS. And it stands for Organic Gut Solutions. And it's charcoal. So if you feed it, you don't want to feed it with any of your expensive supplements because it will prevent absorption of your supplements. So when you feed it, you need
Good to know.
feed it separately from all of your other, things you're spending money on. So like what we were thinking about recommending for people to do is maybe do a month in the fall and a month in the spring, because that's when we see all these inflamed flares and the Lyme flares and the EPM flares. And that's when horses get ulcers sometimes because of diet changes and all these weird things. So I think if you did that for a month, fall and spring, you might prevent a lot of problems. And so what we were thinking is maybe you do, your AM feed is your supplements, whatever those are, and your PM feed has the charcoal. Or if you have to feed your supplements twice a day, then you need to do a lunchtime, just a couple of handfuls of food with your charcoal in it, just to get it into them. So, okay. So I think that covers that.
Well, and heavy metals, my horse was off the charts in lead, cadmium, and mercury when I tested him. It'll be almost 2 years ago. And I mean, he's on a detox formula. It's come down in half, but it's been interesting because he is PPID and he's gone through phases of detox with personality changes.
Oh, I bet. Yeah.
So there was
you might look at, definitely for him, I would look into the OGS. And what we're doing is we're creating we're calling it a glutathione protocol. Glutathione is really important for detoxing and getting the liver functioning. And so we're adding in OGS and milk thistle and N-acetylcysteine and kind of using that as our clear out the liver and detox, twice a year program. So that, especially for those, a horse like yours that has a heavy metal burden and has Cushing's, I think something like that would be a great idea.
Yeah.
So second one that we were going to talk about was, colic, and we kind of touched on this. So, I think the big thing is winter colics are usually impaction colics, and it's usually related to not drinking enough water and eating food that's much drier than what they were eating before. So, you see the gas colics usually associated with barometric pressure, diet changes. If you go from hay to a whole lot of grain all of a sudden, that's when you get the gas colic that, would be maybe something that might be more surgical, right? But in general, winter colics are impaction colics, and that's usually when the vet comes out and they tube them and give them something that's going to pull all the water into their gut. Or maybe do IV fluids, which kind of does the same thing. It saturates the fluid in the gut and gets everything moving. So I have a couple easy things you can do to help prevent those impaction colics. So the first one is add salt or trace minerals to their food. So, back when I lived in North Carolina and, we were trying to come up with really simple options for people that were, you could go to the grocery store and just get a container of salt, right? And we used to always say it's kind of like the peanuts and the pretzels at the bar, right? So, you're feeding something salty, and so you buy another beer, right? It's the same concept. So you're going to add salt to their feed so they'll drink more water. So we used to do a tablespoon twice a day. Add, if all you can afford is table salt, that works. If you want to do a trace mineral salt or a sea salt, because those might be a little healthier, you can do that too. So anything that encourages them, because it's bringing salts into their body to drink, is really good. And then the other thing is warm water. So, having heated troughs. If you don't have heated troughs, insulating your troughs, you can put covers on them, and insulation around the outside of them to keep them warmer. So anything you can do, add warm water to your feed so that they're getting extra water in what you're feeding in the winter, so anything you can think of that adds warm water to their diet will help prevent impaction colics. So get creative on that. And then the other thing that I use a lot for colics is that I have a product called Magnolax, which is basically powdered Mylanta, and it's I think it's $12 for a pound. So it's really inexpensive. But you can also, run to the drugstore and get Mylanta, and we usually give, if I have the powder, I'm giving a cup, a half a cup, and repeating it in an hour and I just mix it with a little bit of water and syringe it in. But you can use the Mylanta and do 60 to 100 mils, an hour apart. And what that's doing, it's a laxative, right? And it's going to go into the gut. It's going to coat the lining. So if they have a little bit of low-grade ulceration somewhere, it kind of coats it and makes them feel better, so they want to eat. And then it's going to go right into that impaction and pull water into the area where it is, because they're magnesium salts. And so it hydrates wherever the impaction is. And by having lots of magnesium there, it improves the muscle cells in the gut and, you know, allows for more contraction, right? So you're drawing water into the gut and you're getting things moving. And I think that's way more effective than just Banamine. It's a really cheap, easy thing that, you know, you guys can all keep on the shelf that will help you with impaction colics over the winter. So that's those are my little tips for colics for the winter. Any questions on that?
So things like soaking hay, that would also hydrate?
Yeah, you know, and the reason I don't really, I think if you could steam your hay, they'd probably eat it. I feel kind of bad soaking hay when it's really cold out, because then they're eating frozen hay. And, you know, I feel kind of like that's counterproductive when you're trying to keep a horse warm and you're feeding something to them frozen when it's cold out. So I think if you could feed hay that was maybe soaked in a warm water, or you could keep it somewhere where it was, they weren't doing huge amounts at once, so when you put it out it didn't freeze, then maybe you could do some soaked hay. You know, I think the steamed hay is better because it's warm and it's not going to be so moist that it freezes. But yeah, that's the only reason I wouldn't do it, is more that the cold might not work in your favor with it.
So somebody's asking if Himalayan salt contains iodine and if that can cause any issues.
I don't know. That's a good question. I will have to look that up, and I will try to do that, and I will get you an answer on it, because I don't want to make something up right now and be wrong.
I know most people, because they replaced iodine in bread with bromine because it was cheaper, and so people aren't getting enough iodized salt, because that most people are low in iodine. I mean, that's just a common problem.
I mean, it would make sense, you know, so if you could add in iodine,
I think the amount of iodine in the Himalayan, I don't know what the amount of iodine is, but I can't imagine that it's very much.
Right? Yeah, I will try to look that up for you, because
there's something that makes it pink. I'm not sure what.
But I think that would be iron, right? And so in that case, you wouldn't really want the Himalayan. You probably want just regular sea salt. And this was just the picture I could find.
It's a nice picture.
It's a really pretty picture, right? I mean, like, I usually just feed regular sea salt. But you know, I think that the red part is probably more iron, and at least in our area of the country, we have a lot of iron. So what the problem is with high iron is iron competes with copper and zinc for absorption into the gut. And copper and zinc are really important for metabolism, for hormone production, for overall neurotransmitter and nerve health, for the immune system to work normally. So, you know, for us out here, iron is not a good thing. But if you are maybe in an area that's not so iron rich, if you don't have the red soil and everything, it's probably not as big a deal.
Yeah. Okay. All right.
Are we good on that one?
It's okay. Yeah, we're good.
Okay, so botulism, I think this one is pretty simple. You know, it's a localized population that gets botulism, and what it usually has to do with is that it's an area of the country where it rains a lot when they're baling hay. So it's having dampness when you're baling hay that's a problem. And so especially with round bales, because they might not be completely dry when they're baled, the center of that round bale can then be nice and moist and not have a lot of oxygen, and be this awesome place for Clostridium botulinum to, you know, grow. And so if you were to get that in the bale, the horses may not detect it and they may still eat it, and it can be deadly. So what I have seen in this area of the country is everything from mild weakness to unable to get up. And it is definitely something that they tend to see more in foals, but it can happen in adults. So it's really common in Kentucky in the foal population. We see it more in like our performance horses, you know, or something like that. So we had a case a couple of years ago, and the horse they thought the horse was choking, but it was really easy to get the choke cleared, but then the horse wouldn't swallow and wouldn't eat. It was kind of an odd presentation, and they were really close to the Equine Medical Center, like 10 minutes away. So they went ahead and went over there because they wanted to know what was going on. And because they were there, the vets there were like, oh, this is botulism. And they immediately started the horse on plasma. They had to put it in a sling. You know, it's this very expensive process to treat. And what they basically told, what the vets told the owner at the time was, it's $20,000 to treat, and we won't know until day 10 whether it's going to help. So, you know, to me, that's a very economic question of treatment. If you know you're going to have to treat for 10 days, whether to know if it's going to work, you're investing $20,000 to treat. And we do have a vaccine. So that's why I've kind of had this up here. I'm not a big vaccine proponent, but if you're going to feed round bales, or if you know that your hay is of questionable quality, because it has happened from square bales, it's not just round bales, but more common with round bales, you may want to consider vaccinating for botulism. The vaccine is, it's a large dose, it's 2 mils instead of 1 mil, and you give it once every 3 weeks for 3 doses the first year, and then you just give it once a year after that. So, you know, if you think that your horses are at risk, I think that it might be worth doing. My horses get square bales, and I know that my hay is dry, you know, and I don't have any problems with it, so I'm not vaccinating for it. But if I had my horses in fields where I was getting round bales and I wasn't sure of how good they were, I probably would vaccinate.
And it doesn't have to be from a bale of hay, because I lost my horse to botulism in the summertime grazing in the field. Yeah.
So did you come up with a cause for it?
We never did. He was grazing. No, he and his buddy would always graze together. They were in a field he'd been in before. It was the summer when it was like 106 degrees that summer. This is going back now. The night before, he was totally fine. I got an airplane. Joyce called, said he was colicking, but it didn't resolve. And then the vet finally said, pull out his tongue and see if it goes back, and it didn't. And so she gave him the remedy for botulism, and he responded and crashed, and they put him down before I got home. But it was middle of summer in a field with no hay.
Wow. So then, you know, I think in that case, like, so do you vaccinate for botulism?
I vaccinated. Yeah, the other guys got vaccinated.
Right. Yeah. So, I mean, like, I've heard stories that are kind of similar to that, where you're like, really, this is, you know, you're trying to come up with a reason for it. So,
and there's never been a case of botulism in Rappahannock County in horses ever before.
And that was the one and only.
Yeah.
That's so crazy, right?
It's just bizarre. Like I can talk to not all of them, but I can talk to a lot of these things because I've experienced.
Right. Yeah, no kidding, right? So, I mean, this is like, and I don't do a lot of vaccines, but this is one that I do with a lot of people in the fall. And I think it's just like, because it is really deadly for most horses. They can't survive it. And I think that one horse, like I said, that I know that did survive, it was because they just kind of on a whim were like, well, he's not that bad, but they're, you know, EMC's right around the corner. Let's just go over there and they can deal with the choke. You know, so they weren't even thinking that it was anything like botulism. And I think because they caught it before it was a symptom like botulism, they had a chance. Where I think by the time that most of us would be like, oh, I think that's botulism, the horse is already showing some pretty serious signs, and it's hard to get them back at that point.
Yeah, and it's not your first thought, for sure.
Right.
You know.
Yeah. So I mean, that's one that you guys might want to consider if you live in an area that may have, you know, a risk for it.
Botulism. That's the thing, is botulism everywhere. It just round bales and hay bales are a possible concentration, but I mean, it's in the, I mean, that was the thing, is it's in the environment.
Right. Anywhere that you have moisture.
It was bizarre. It was totally bizarre.
So strange. Yeah. Well, and the good news about that particular vaccine is it seems to be relatively safe. There are very few side effects associated with it. So I feel pretty safe saying go ahead and do that one, you know, if you want to.
Right. I don't understand Botox.
Yeah, I know, me either. When like Dr. Manson was trying to use Botox for laminitic courses. This is like maybe 10 years ago, because it's supposed to relax the tendons and ligaments, kind of an aside that you guys might think is interesting. And so they were injecting the flexor tendons to prevent the rotation of the coffin bone. And he said it worked really great initially, but what they found is that when it wore off, things were like twice as bad.
Ooh.
And so they stopped doing it. But yeah, that's why I would be like, I wouldn't use Botox either. But I mean, if people have tried to come up with a good use for it, I don't think we have any. Okay, so then respiratory disease. I kind of have this broken into two different sections. So the first one is your allergies and your asthma. Wintertime, we get more asthma associated with being inside the barn. So it's usually dust, molds, hay above the horses. If you have a lot of hay dust coming down, really dusty shavings, which happens a lot, So it's usually particulates, lots of whatever that is, lots of particulates in the air. That's making it hard for them to breathe. So the trick is to soak your hay, use a hay steamer, water down the shavings, if they're really dusty, take the hay out of the barn, if you have a horse keep the horse out of the barn, whichever one you can do, anything you can do to eliminate that. I would think too, this might be another one where using that organic gut solutions, the OGS, might be something to consider, right? Because that helps get rid of a lot of the buildup of stuff in their system. And when we talk about allergies, there's a big connection between the gut and the skin and the lungs. They seem to be the areas that are more the internal reflection of the exterior world, right? So anything that we can do to eliminate what they're having to deal with is probably a good thing. So hay steamers are great. If any of you guys have horses that have winter problems, I would invest in a hay steamer. They're between $600 and $1,500, which seems like a lot, but when you start using them, I've never had anyone get one and say it wasn't the best thing that they ever did. So if you have a horse that has asthma, consider the hay steamer for sure. It makes your barn smell amazing. They have it smells like you're cooking, I don't know, oatmeal cookies all the time. It's just absolutely amazing. And it will definitely help them. So that's part of the respiratory disease. And then the other ones that we see are things like respiratory viruses, flu, rhino, just like people, right? The horses are going to be inside, they're going to be closer together for longer periods of time. It's cold, it's dusty, they're coughing because of the dust already in the environment, so maybe they're a little more prone to immune suppression because it's winter. So all it takes is a horse to go travel to another barn where another horse has flu and bring it back, and your whole barn can get it. It's really easy. So, my thing with flu and rhino in general, if it's just respiratory, not neurologic rhino, but if it's respiratory, is, it's treat the symptoms, treat the fever, keep them hydrated, just like us, drink fluids, right? So we have them drink lots of fluids, stay hydrated, and they'll get over it in a few days. And they usually have clear to maybe mildly white nasal discharge with a virus. So, a high fever is often a part of it, but the nostril discharge will be relatively clear or kind of a white, frothy sort of discharge with viruses. So, that way you kind of know what you've got. If you get thick yellow and lots of discharge and snot from the nose, or green snot, then you probably don't have a virus. You have something bacterial, and that could be secondary. You could be heading towards pneumonia, just like people do, or you could have a different kind of bacterial infection. Like we don't really talk about strangles that much, but something like that. It could be all kinds of things. So looking at checking for a fever, looking to make sure they're eating and drinking, making sure they're passing manure, making sure all that's normal, and then knowing what sort of discharge you have from the nose. Those are all things that can be really helpful for you to talk to your vet about, that will help them decide if they need to come out and see your horse, or if they can help you over the phone, or, you know, how you can get through these things. So I would just think about all that stuff if you happen to get respiratory disease. And, you know, just like we were talking about for our treatments, it's get rid of the dust as much as possible, minimize how much they're breathing, you know, if it's cold, and if you do get something viral, treat with you know, Banamine, whatever, for the fever and fluids. And I give Magnalax again, or the Mylanta, like we were talking about with the colics. That's one of the things I put them on whenever they have a fever, to keep things hydrated and keep their gut moving. So, you know, it's just kind of something we do along with it to make sure that they don't colic in the process of getting through whatever they're going through. Any questions on respiratory disease? Good. All right. This is good. See, I didn't even make that many slides, and it's taking me an hour. This is fantastic. I'm so happy. This is kind of the last one that's like for, you know, winter woes, and then I just have a couple more to chat about. But so the big things that we see here with our ice and snow is lots of bruised feet. So with the ice that we get, especially in January and February, we'll get these ice balls on the inside of their soles, you know, so they'll have a ball here and they're trying to walk on it. And if that gets really hard, it can cause bruising on the sole, and get little cuts on their frogs or in the sulci, you know, so all kinds of stuff. And what will happen with those is they'll either bruise over the winter and you'll see it, or they might not really show you what's going on in the winter because their feet are so hard and frozen. And then as soon as you hit that first spring thaw and the foot warms up again, the bruise will end up turning into an abscess or a bruise, and then you'll have a horse that's lame and you have to cut that, you know, open up the abscess and let it drain. So those are pretty common. You know, so if you do a lot of riding in the ice, they make shoes that kind of come out so that the pad is on the outside a little bit to keep the ice from balling up in there. So you can consider something like that. If you're doing a lot of riding on the snow and the ice, you may need a shoe that has more traction too, to prevent slipping and sliding around. So, you know, talk to your farrier about that, but it's really common to get bruising in the feet, and, you know, maybe
last winter it was awful footing. It was so bad.
With that, like we had a month of ice last year. It was terrible.
Yeah, and it was rutted and lumpy and awful. They didn't want to move. They were just standing there.
Right. Well, and then the other thing that happens with that, if it's really icy, is that they do decide to move when they shouldn't be, and then they fall over. So we had another client last year who had a young horse that went out and on the ice in the middle of the winter and was feeling super, you know, energetic and happy, and she went to buck and rear, and her feet just went right out from under her and she slammed onto the ground. And it took 3 months for any of us to figure out what was going on. She ended up fracturing a rib. So you know, it just took a long time to figure that out, because she started acting kind of cranky on her saddle, but they couldn't quite figure it out. You know, it wasn't really a lameness, and you know, she's fine now, but you know, they can do some interesting things to themselves on the ice.
And ribs are painful.
Yes.
Ribs are painful.
You know, we forget about that. You know, so definitely, you know, think about that if your horses are going out on ice or really wet, melty footing, or, you know, because the mud's going to be worse in the winter, you know, that they are more likely to slip and fall, do something ridiculous. Horses can hurt themselves in the middle of a sunny day without any problems. So you give them bad footing when a friend that decides to do something, or a truck drives by, or a bird flies out. And I mean, you know, you never know what's going to do something that's going to make them move in a way that you wouldn't expect. So we see more of that in the winter. And I think too, you know, a lot of horses with blankets on will get weird rubs, or they might have they got a foot stuck in it, or somebody grabbed them the wrong way and pulled on the blanket. So you can get some interesting injuries just associated with wearing a blanket for the winter. So I think those are the kinds of things we see, just a combination of that stuff. Just being aware of it, knowing that you can't necessarily prevent it, but if it's super icy, maybe you don't turn them out as a group if they've been stuck in for 3 days, and let them go run around, right? Just be more careful when you are turning them out, knowing that they might do something they shouldn't. So that's that. I have a couple more slides. We got like 5 minutes. So does anyone have any questions at this point? Are we good?
We seem to be good.
Okay. All right. So these are just like, I figured if I had 5 minutes for a soapbox, I would do it. So, this is kind of for me, what I have been seeing, just because I switched my practice from being everything, general practice, emergency routine, holistic, osteopathic, trying to fit it all in to backing off of doing the routine work and the emergency work. So I'm getting a lot of feedback from my clients because they're having to find other vets to help them out. And so we've been having this discussion a lot about making choices about how your horses are cared for. And I think it is really important that you, as the owner of your horse, realize that you know what your horse needs better than anyone else. And that veterinarians and farriers and trainers are only human, and we only know what we know, and we're going to learn more every day. And maybe we learn more because you spoke up and told us something about your horse that we didn't think about. So our learning curve is based on what you guys share with us. And I think that we need to consider that, yes, you want your veterinarian and you want your horse, dentist and your trainer and your farrier to know what they're doing. But don't consider any of us to be, it doesn't come from God to us, to you. We're not authorities. We're learning too. And so you need to know that you have the power to tell us how you want your horse cared for. And it is our responsibility to listen to you and work with you on a plan. And not tell you that you have to do things our way. So if you're running into that where you're feeling like you're really struggling and you're having a hard time having your view listened to, it means that you aren't with a person that's listening. So you either need to speak up and tell them that they're not hearing you, or you may have to find another person that matches with you better. Don't be afraid to do that. There are lots and lots of people that can help you. But I feel like that is something that I'm certainly running into a lot, that there are a lot of egos in the horse world. And I think that those of us that own horses often feel like, well, we don't know anything, especially you guys that are new horse owners. And so you're afraid to speak up, and you need to, because just because you haven't been doing it forever doesn't know that you don't know your horse better than we do. So, when I look at veterinary medicine in particular, because that's what I do, so I can talk about it a little more than the others, I feel like we have changed a lot in the last 20 years. So we've gone from being your family friend to your business, a business partner that is trying to run a successful business and, getting a lot of pressures to succeed in our own world. And so I think sometimes that means that we're making decisions based on what we've been told by the authorities in our world that we should be doing. And I think that happens in human medicine too, right? That the consensus is that we do this. And so this is what we're going to tell you to do. And a lot of us are very uncomfortable getting away from that. It's a protocol and we feel very safe with it. But, again, your horse better than we do. So I think it's really important that everybody realize that you do have the power to have a say. So how do you make that decision? You need to look at things like, when you're talking with your veterinarian, you need to ask things like, let's say, for example, you're talking about a particular treatment. You should ask things like, have you ever used this treatment before? How often do you have side effects? What are those side effects? What should I expect if we do this treatment? How often are we going to have to do this treatment? What is the prognosis based on doing this treatment? Is it a 60% improvement for 2 weeks, or is it a 90% improvement for 2 years? Or is this I don't know if it's going to work, but we're going to try it anyway. I think that sometimes some of that stuff gets left out in the process of making a decision. So you need to ask all of those questions. What is my cost? What is my cost for the year or for 5 years, based on what you're talking about? what is the aftercare? Like if you have a horse that goes to colic surgery, they're going to tell you it needs to be in a stall for 3 months. So, not all horses can handle that. So you need to make sure you're thinking about that when you're trying to make a decision. What, how much is it going to cost me? Is this favorable for the animal, based on the prognosis? And, can they handle the aftercare? Is it worthwhile? And don't be afraid to ask why, just like, with the iodine question, never be afraid to ask a question. And just because, we don't know the answer doesn't, we can always find an answer, right? So, ask as many questions as you want. And ask, when I was in vet school, they told us that we should when we present people with options, we shouldn't ever present just one. So, they always said you should kind of have an A, B, and a C option for everyone. So, your A is your gold standard. If you had all the money in the world, what would you do? And your B is kind of the middle of the road. And then your C is, okay, we have to do this on the farm with limited resources. What would we do? And I think sometimes when you get people to present things with multiple options like that, maybe you can get a better idea of what's going on, because they can give you different prognoses, or maybe explain what's going to happen with different treatment options that might make it easier for you to make a decision, than if you just do whatever they tell you have to do the first time they look at it. So I just am seeing a lot of people struggling with that.
It sounds to me like you have to be your horse's advocate.
Yes.
And what often happens is that the emotions get involved and we forget that we have to be their advocate and deal with the emotions later.
Right, exactly. Yeah, I think that's a big part of it. And I do think that a lot of us are, I hear even with my husband, if he takes the kids to the doctor, he'll be like, well, they're the authority. I believe that they know what they're doing. And I'm like, but you didn't ask any questions, and you didn't ask if they actually needed that, or, why we were doing it, and I think that a lot of people just believe that, well, they know what they're doing, so I'll just do it. But there's no reason why you can't ask why. So yeah. I just felt like I needed to put that out there.
No, I think it's a really important thing. And the other thing that what I've learned is if somebody says just, if they don't want to deal with your questions, maybe you don't want to deal with them.
Right. I know, right? It's true. Yeah. So,
yeah.
I mean, hopefully there's someone out there that's listening to this that needed to hear that. So I'm just adding it for those people.
Yeah, no, it's great. It's great. I think it's really important. And, but it is hard sometimes in the throes of something. And that's where the other thing I would say, if you as the owner are struggling with the emotions, bring somebody with you that can be the advocate.
Yeah, that's a good idea.
Right. Because sometimes, like, I was on a plane, my horse is dying of botulism, right? And so I'm an emotional wreck trying to get home, but I had somebody else there to be his advocate and make the right decision and make the decisions.
Right. And that's a really good point. Having someone who is not trapped in all of the emotional part, but that can make sure that their focus is on making the right decision for the horse. Right. So if they just keep that's where they're headed, I think that can be really helpful.
And it's I think we had somebody else, it was another webinar, and it's a form that's on my website and it's free. It's on the Murdoch Method shop. But it was more about, if you had to put your horse down, right? What's it called for people? It's the same thing.
Oh, euthanasia.
Yeah, but no, what the form is like, with my mom, I had
like a living will sort of thing.
Yeah, kind of a thing. Like it's really important to sit down before you have a drama and figure out, if something happens to my horse, especially like with a colic surgery, can I afford it? And can I afford the aftercare? I mean, have the numbers, have the facts in front of you, make the decisions when you're not emotional, when you can seriously look at your situation. If you're a family and you have 3 kids and your horse is ill, is it really, like, if you don't put the horse down and your kid's not going to eat for 3 weeks, right? I mean, that's the kind of thing that I mean, is like, and evaluate that ahead of time when you can think rationally. So, and then write it down and have it like at the barn, so that if something happens, they can make the decisions that you would like. What if you're not there and the horse has a colic?
Yep.
Right, and they can't get a hold of you? If you've already thought about it ahead of time, then and this, I can hear Rebecca Husted in my head here. We've done many webinars with her. She's the technical large animal rescue person that I've had. But planning ahead so that you're not trying to make a decision when you're in an emotional state.
Yep.
DNR, that's it. Do not resuscitate. Thank you.
Right. Well, I mean, that's what I think I've seen that on boarding contracts, even when I was in college, that they were like, if my horse colics, can he have surgery? And how much are you willing to spend? And that way, if they couldn't get a hold of me, they knew, like, okay, this one isn't going to surgery. So whatever you can do on the farm is what you get to do. Or, okay, this one's insured. It can go to the hospital, and, this is what's happening. I think you already have to have all that written down so that if you are unreachable, that things can happen fast.
Yeah. No, it's just, it kind of fits with all of what you're talking about here. It's just, take a moment to think about those things and make a decision ahead of time, so you're not making the decision in the emotional throes that puts you in a worse situation in the end.
Yep, I agree. Yeah.
Well, this has been, okay, a little bit of a downer note at the end, but the bottom line is that's what this webinar is about, is what are the risk factors that you might be facing going into winter, and how can you mitigate that or make a plan so that, if something does happen. I love the idea of the Magnalox.
Yeah, it's just so super cheap and easy, and it's a food animal product. I learned about it from Dr. Waldron, who uses it with her endurance horses, and uses it for colic. So that's where I learned it from, and it's like magic. It's the best thing I've ever started using. It's great.
All right, so just unshare your screen. We'll wrap this up, and this is great. Anybody got any last questions? Anything in the chat or the Q&A? No? All right. Well, thanks everybody for joining us. And just remember, you can find this and all the other webinars on the Surefoot Equine YouTube channel. And we make podcasts, like this is one that could easily become a podcast. They're called Wendy's Winnies. You could find them on iTunes and I think Google and Amazon, Wendy's Winnies. So the podcast, you're not watching, YouTube driving down the road. It's much better.
Right. Yeah, exactly.
All right. Thanks, everybody. Have a great night, and we'll see you again soon.
All right. Thanks,
Bye.
Wendy.
Thanks, Emery. Bye.